All right, guys, I got a very special video for y'all today. Today I'm talking about what's in my nursing bag, everything I got in it, and why I use it. All right, let's get into it. Hi everyone, I'm Keeks, and if this is your first time watching, go ahead and hit that like and subscribe button down below for more videos about nursing, hospital life, and just personal growth. All right, let's get into it. So what is a nursing bag? Not everybody has them, but for me, I think they're a lifesaver and they cut down on time and me running around looking like crazy in the med room. So this is my nursing bag, and this really saves a ton of time for me while I don't have to run back and forth, and I'm gonna go break down everything for you right now. All right, so usually I'll have this sitting on my cowl hooked up onto it, and while it's swinging there, I know exactly where everything is in my arms. I pretty much have this set up and I can grab everything accordingly because I pretty much live this with this every single day. So we're gonna start from the inside out. Most importantly, to start off with, I have a mass amount of flushes. Can't go wrong with having some flushes. I have about 20 in my pack at all times. I'm gonna go through these. I'm probably gonna still have to refill this about twice at least throughout the day. It gets busy. You're flushing those IVs, you're cleaning wounds, whatever it is that you're gonna need this saline flush for, you got it on hand. So for my bag, I actually use cups, plastic cups in here that I use to actually separate everything in the bag. And with that, I have different compartments, and it keeps everything organized and keeps everything from shifting around in my bag. So I'm gonna start here. I have my 10 cc syringes that I'll use sometimes for flushing, sometimes I'll use for drawing back if I'm gonna be drawing blood from a PICC line or something else like that. And then next to them, I have my 3 cc syringes. With these, I'll usually do my administration of medications with these types, and I also use the blunt needles. So I have plenty of blunt needles if I'm going to be drawing up any kind of medication with these, and so that's those will be right there. Next to that, afterwards, is going to be my medicine cups. I have my medicine cups on hand. I have plenty of these here to go ahead and administer those medications. After that, on this other side, I have my alcohol prep heads. Plenty of alcohol prep. I use alcohol prep to take off bandages, IV taped, anything like that, cleaning hubs, or whatever you're gonna need IV swabs for. It's right there. Have to have plenty of them. Next to that, I usually carry tape in there, usually paper tape or transport tape. And you know, gets heavy, and I actually go through this quite a bit. That's why there's only one in there, so I need to get that restocked too. Past that, I have my set of cotton tip swabs, and the reason I use these is for wound care, or I also have my ability to measure out my wounds with these, and I'll take pictures of wounds on that side. Next to that, I always carry straws in case my patient needs a straw to drink their water for the medication administration. So let's go on to the side of it, and I have that organized also. So while it would be facing me in the front here, I have my IV tubings right here. I have my primary tubing. I usually keep 2 on hand. Never know when you're going to need to change those out, or you have a new admission and you're going to have to go through that. And on the inside, I have my secondary tubings here for any kind of piggybacks or anything I need to use. Now, actually going counterclockwise from my IV tubing, I actually have my 2x2s. I'll use that either if I'm going to be taking out an IV, or I need to go ahead and stop any type of blood, or some minor cleanup. After that, I have Tegaderm if I need to reinforce an IV or anything else that needs to be done with wound care at that time. Next, I get into my IV set. So my next 3 are set up for IV. I have my start kit, my IV start kit, which will have a Tegaderm, a tourniquet, the alcohol prep pad, and tape along with that. I go through these quite a bit because I start IVs pretty much for everybody on the floor if they need me to. I also have my my IV loop tubing for the saline lock, and I'll have about 3 of those. Now moving on, I have my IV catheters. I have my 22s, my 20s, and my 18s. I usually have a lot more of the 20s because that's my most common one, and I really try to stay away from the 18s or the 22s if I can help it. Now flipping to the outside of my nursing bag, I actually keep my insulin syringes here. I have probably about 15 to 20 in my bag, and that's mainly because here in San Antonio, we have a lot of diabetics. You know, our food's good, and so we have tons of diabetics here. And I also work on a renal floor, so you know pretty much everybody is a diabetic. I'll be going through these about every meal. Next to that, I have my sterile syringe and my IM needle in case I need to push anything that would be given IM or even a sub-Q. And then after that is kind of my miscellaneous pocket where I have my wound care scissors. Get yourself some nice scissors. Those ones that you get in kits, they're really not that great. I have some stainless steel scissors here, and they do great for whenever I have to do any colostomy bags or any kind of wound vacs or any kind of changes like that. Definitely get yourself some quality scissors. I have some notepads, anything I need to take notes for a doctor. Sometimes they give me numbers or any kind of quick notes I need to jot down, maybe a family's phone number or anything like that. Plenty of pins, because you're going to go through pins pretty quickly here in the hospital, and people are going to ask them for you and you're never going to get them back. After that, I have my personal hand sanitizer for when I don't have ability to foam in or I'm not near a sink right now. I still be able to sanitize my hands. And of course, last but not least, my lifesaver, my Tums. I don't know what it is after I turned 30, but I got heartburn nearly every single day. So I always keep some Tums on me because I don't know where I'm walking at and I will die without these. So I always keep Tums on with me at all times. All right, guys, that's everything that's in my nursing bag. And if that's something that you're interested in, you can go ahead and find these online. You can find them under craft bags is usually where they'll be located. I would get them on Amazon. I got these a 2-pack for about $10. You can get them at Hobby Lobby, or you can get some fancy ones. They can get all the way up into like $50. But I really suggest you just get something cheap, something durable, something that's going to be able to clean off really easily, and find something that fits your needs. Now, for me, this is more towards wound care and doing everything for IVs and hospital administration. Everybody's going to be doing something a little different on the type of nursing and the type of unit that you go on into. So go ahead and find that bag. Maybe this one's a little too big for you. Maybe you like something a little smaller. Sometimes maybe you need something a little bigger. That's up to you. Try it out. Get a little bit more familiar with them. Sometimes you can even find these in the thrift store for about like $3. I actually did buy a whole bunch of bags for the people on my floor, and we got these nice craft bags that I could find for dirt cheap at the thrift store. They're able to clean easily, they're durable, and you know, they came in a variety of sizes, and everybody seems to love them. So I want to thank you for watching this video, and if you really enjoyed it, go ahead and hit that like and subscribe button down below. Hit that notification bell so you don't miss a thing. I usually post once a week. Leave in the comments below if there's anything you want me to go over, any suggestions, maybe talk about what's in your nursing bag, or if this is something new to you and you maybe want to try it out. Any comments is appreciated. Thank you guys, and good night.